This video shows how to use the DPP Zika IgM system with venous whole blood, serum, and plasma. The DPP Zika IgM system is the world's fastest Zika test. It is used to detect IgM antibodies to Zika virus in 3 easy steps: prepare, run, read. Components included in the kit are shown here. The following components are not included in the kit, but required for the test. Before you begin, remove the DPP test device from its foil pouch and place it on a flat surface. In the test window, check to see that the blue and green lines are visible before proceeding. Label the test device with patient ID. To begin the test, gently squeeze 5 drops of the sample buffer into the sample vial. Use standard phlebotomy procedures to obtain venous blood, plasma, or serum sample. Collect 10 microliters of blood sample with a calibrated pipette and transfer sample into the sample vial containing the buffer. After mixing, open the cap, transfer 100 microliters of the sample into well 1 of the DPP test device, and wait for 5 minutes. The colored lines in the test window should start to disappear within a minute. If not, discard the test device and repeat the procedure with a new one. At the end of 5 minutes, add 5 drops of the sample buffer into well 2 of the DPP test device. Wait for 10 minutes. To set up the DPP microreader, insert it into the holder cavity, ensuring that it lays flat and the button and battery compartment face the user. After 10 minutes, place the microreader with the holder on top of the test device. Press the button once. On should appear in the display. Press the button again. The display will read RFID and then Test. Press the button a 3rd time and the display will read Run. We should see results on the reading window in approximately 3 seconds. A numerical value greater than or equal to 20, followed by R, means the test is reactive. If the numerical value is less than 20, followed by NR, it means the test is non-reactive. If the display reads INV, it means the test results cannot be interpreted, and the test should be repeated with a new device. If you have any questions, send an email to info@chembio.com.